My name is Sandra Holtzman. I'm a myofunctional therapist and a dental hygienist by training, and I work with my patients doing myofunctional therapy. I work with a lot of dentists who use all sorts of lasers, and they do all sorts of tongue tie and lip tie procedures, but I always recommend to patients to find the dentists who are actually doing the releases in the best possible way. And I really do think that the dentists who have training with the LightScalpel, they aren't just using a laser, they are really understanding the big picture, and they're doing a great job for their patients. So as far as finding providers, I'm always looking for doctors who actually use the LightScalpel regularly and who are good at it, and it's a priority for me. I work with a lot of dentists who use the LightScalpel, and I know that it's really transformed their practices. It's helped their patients get better healing and better results from the procedures that they do. I know that these doctors are passionate and they care so much about their patients, and I think the LightScalpel helps them be able to give the best care possible that they can. So I went to the LightScalpel headquarters in Bothell, and I had the opportunity to learn with Peter and to listen to him lecture, and it was the first time that I ever actually realized there was a big difference between types of lasers. So I didn't know until very recently that there's a huge difference between a diode laser and a CO2 laser, which sounds crazy, but I always just thought all lasers are created equal, and it wasn't really until that lecture that Peter gave, getting to have exposure to that information, that I realized there's a huge difference, and it's really significant in healing. It's a much easier procedure for the doctor to do, and it's just the outcomes of using that CO2 laser are so much better overall than maybe other options. I had the opportunity to try out the laser on the pig jaw, and obviously I'm not a dentist, I don't do procedures like that, but it was a pretty cool experience to see how it worked, and it seems pretty easy. I mean, I'm not gonna, like I said, I'm not a doctor, but